This is an MRI scan of a patient who came to me with pretty severe leg pain. And the pain was starting in the low back, radiating down the back of the leg to the calf. Numbness, tingling had just not been getting better after doing physical therapy and taking medications, anti-inflammatories, and even having some injections. And despite all that, was still having pretty persistent leg pain that was affecting daily activities and just day-to-day life. And on the MRI scan, we can see on this side, which is looking at you from the side, we can see the bones here, and we can see the discs that are the cushions in between the bones at every level. And your eye is quickly drawn to this protrusion right here at the bottom level, which is the L5-S1 level. And we can see that disc herniation pushing into the canal, which is where the nerves run. This view on the right side of the screen is an image that's actually an axial image. So it's as if you're taking a slice through the body, and we're looking at it as if the feet are coming out of the screen and the head is behind the screen. So this is actually the right side and this is the left side. And we can see that here is that same disc herniation that we see on this view. We see it here pushing out into the canal. On the right side, we can see this little dot right here, which is actually the nerve. And that's the nerve on the right side. And on the left side, you can't see that dot because the nerve is being pushed on by this large disc herniation. And as a result of that, that is what gives the shooting pain that goes down the leg. Some people call it sciatica. You may hear us call it radiculopathy. But that is a good example of a herniated disc that's pushing against the nerve that would cause that problem. So if somebody has had this and it's been debilitating and has not gotten better despite non-operative treatment, then that's where we discuss surgery. And the surgery that we perform in this case would be a discectomy, which is to remove the piece of disc that's pushing against the nerve. This can be done in various ways. In this particular case, this was done through what's called an endoscopic approach, which is where we make an incision about the length or the width of a fingernail, and can go in with a camera and small tools in order to remove that disc without having to disrupt any of the bone or the soft tissues. So this is an image. This is a post-operative MRI of the same patient, and we can see that that large disc herniation that was present has now been removed, and now you can make out the dot on that left side. So the nerve is now visible, and it's not being pushed on anymore. And after taking that disc herniation out and removing the pressure on the nerve, the leg pain essentially is resolved, and people can get back to doing their activities without having that shooting pain going down the leg. This surgery is an outpatient procedure, so people can go home the same day. Oftentimes they don't need any pain medications other than Tylenol following the surgery, and can be up and walking the same day of surgery and afterwards. Typically the restrictions that we give folks following a procedure like this is just no strenuous activity, no heavy lifting or really aggressive bending or twisting for a few weeks, but then once they're recovered, are able to get back to essentially all activities without restriction.